23.6 million adults and children in the United States have diabetes. 7.8% of the world population has diabetes. Have you ever heard that diabetes isn't that serious of a disease? Well, the truth is, diabetes kills more people a year than AIDS and breast cancer combined. 2 out of 3 people with diabetes will die from heart attack or stroke. Like any disease, diabetes comes with its own set of symptoms. Fatigue, unexplained weight loss, excessive thirst, excessive urination, excessive eating, slowly or poorly healing wounds, infections such as yeast infections, urinary tract infections, or skin infections, all due to a suppressed immune system, blurry vision, an altered mental status such as inattention, unexplained irritability or agitation, extreme lethargy can all be signs of having a very high blood sugar. Common complications include damage to the retina, which can result in blindness or other complications such as glaucoma. Damage to the kidneys, which can result in kidney failure. Because nerve damage is so common, this can lead to ulcers, blisters, eventually leg amputations, and of course losing feeling in the limb where you've lost the nerves. A damage of nerves in the nervous system can lead to paralysis of the stomach and the inability to control heart rate and blood pressure during postural changes. It accelerates atherosclerosis, which is the formation of fatty acids inside the arteries. This can lead to heart attack, stroke, and decreased circulation within the arms and legs. It also makes it harder to fight infections, which makes it harder to control glucose. So what exactly is a low or high blood sugar? You hear that term a lot with diabetes, and honestly you're kind of just expected to know it. But to tell you the truth, I sat down a few minutes ago and I'm sitting there and I'm like, what exactly is high versus low blood sugar? Like, you hear it, but you don't really know what it means. I'm going to go over that. Hopefully you know by this point in your life that your body does need some kind of fuel to run off of to keep you going. We usually get our fuel from simple or complex carbohydrates. The body needs fuel to work. One of the body's main sources of fuel is sugar. Hopefully you can kind of put 2 and 2 together. When you have a low blood sugar, your body obviously can't make that fuel to keep you running, which is basically why it is dangerous to have a low blood sugar. So in terms of high blood sugar, as you know, the body will take sugar from the bloodstream and convert it to fuel to keep you going. However, if you have too much sugar in your bloodstream, the body doesn't have anything to do with it, it'll keep it there. Now, the longer the sugar is in your bloodstream, it actually starts to coat your red blood cells, making them stiff and causing circulation problems. These circulation problems then cause high cholesterol, which unfortunately doesn't present itself until further down the line. Sometimes it's too late. This is why diabetics have to monitor their cholesterol more than the average person. I'm sure you've heard there are 2 different types of diabetes. Allow me to explain the differences. Type 1 diabetes, also known as juvenile or insulin-dependent diabetes, occurs when the pancreas produces little to no insulin. Though it is most commonly diagnosed in those 30 years or younger, hence the juvenile part of juvenile diabetes, it can be diagnosed at any time. To control type 1 diabetes, insulin injections must be taken multiple times a day. It's also important to have a healthy diet and get regular exercise in order to properly control glucose levels. Type 2 diabetes, also known as adult onset diabetes and non-insulin dependent diabetes, is when the pancreas produces normal levels of insulin, however, the body has trouble using it. About 85% of patients who have type 2 diabetes are obese and have very high carb diets. Similar to type 1 diabetes, patients can become insulin dependent. They also need to manage their glucose levels by healthy diet and exercise. Symptoms may be mild to none as the body adapts to the rise in glucose levels. Now that I've talked to you about type 1 and type 2 diabetes, I'm going to talk to you about prediabetes. Before most people develop type 2 diabetes, they develop what's called prediabetes. This is when your glucose levels are high, but not quite high enough to be considered diabetic. Did you know that there are 57 million people in the United States that have prediabetes? People who develop prediabetes can prevent getting type 2 diabetes by making healthy changes to their diet and increasing their physical activity. By making some of these changes, you can even return your blood glucose level to a normal level. Studies have shown that by just getting 30 minutes a day of moderate physical activity, coupled with losing 5 to 10% of your body fat, can reduce your risk of developing type 2 diabetes by 58%. Would you know what to do in the event of a diabetic emergency? Diabetes can be managed with regular physical activity, healthy eating, and of course taking insulin. Did you know that before 1921, before insulin was discovered, everyone that was diagnosed with type 1 diabetes died within a few years of diagnosis? Your insulin intake also has to be balanced with the amount of food you take in and the amount of physical activity you do every day. Adults, especially with diabetes, are at a higher risk for developing cardiovascular disease. On top of monitoring blood glucose levels, people diagnosed with diabetes will also have to monitor their blood pressure and their cholesterol more than the average person. Diabetes isn't exactly a selective disease. There are plenty of famous people you know that also have it. Aretha Franklin, Jerry Garcia, Randy Jackson, Nick Jonas, Patti LaBelle, Rick James, Neil Young, Halle Berry, and Larry King, just to name a few.
My name is George, and I have type 1 diabetes.
At what age did you find out you had diabetes, and what symptoms are present?
I was 28. I was constantly nauseous. I was always lethargic. My sleeping patterns were off, and constantly thirsty.
Is there something in your diet you have to monitor more than other things, and did your diet change when you found out you had diabetes?
Yes, I have to watch my carbohydrates, my intake. I have to stay away from sugars, and that's about it really, just the carbohydrate intake.
How do you control your sugars?
I control a little bit with diet, and I take insulin a few times a day to control my sugar levels.
How often do you have to check your sugars?
I test my sugars about 3 to 4 times a day, before every meal at least, and then when I go to bed.
What are some signs you have a high or low blood sugar?
When I'm really high, I get really thirsty, I'm really, really tired. Sometimes I'm nauseous, and when I'm low, I get really shaky, and my heart races really fast, and I have something like tunnel vision.
Have you ever been hospitalized?
Yes, at one time I had a really low episode of my sugars. I crashed, and I had to be taken to the hospital so they could bring me back up with an IV with dextrose to bring my sugars up to a certain level.
There are common misconceptions with diabetes. The biggest one being it's not serious. It's not that big of a deal. It's not true. I've heard before, like, hey, what's the big deal? You know, you take some insulin or you eat some cookies and you're fine. That's not true at all. Sure, for that moment, you're going to be all right, but later on you're going to have problems from constantly changing blood glucose levels. Hopefully after seeing this video, people won't hold on to those misconceptions anymore. Obviously, you're about a class of maybe 20 kids, and these misconceptions are everywhere. I honestly didn't know how bad diabetes was until I researched this. I have people very close to me that have diabetes, and even then, I still didn't think it was as bad as I know it is now. Type 1 diabetes, also known as juvenile diabetes, and what's the other one?
I was throwing up a lot.
As a result, the body starts burning. What is it burning? Have you ever been hospitalized?